Hello, friends. How are you doing? Welcome to the YouTube channel Health Q. How are you doing, guys? I hope you all are fine. As promised, I'm here at 4 p.m. talking to you regarding your health questions. So, let me just go through the entire process of what is today's live session about. So, since long time I have not done a Q&A, so this session is going to be that. Plus, I'm going to be announcing the winner of the giveaway that I was hosting. So, first of all, thank you so much for participating in this giveaway and helping me reach 10,000 subscribers. This is my first live video session after reaching the 10,000 subscribers. So, thank you so very much for helping me reach this mark. It's a major milestone for me. I remember 2 years back in 2017, I started my YouTube channel. I was not sure how successful it would be or else where I want to take. It was just a random thought and random idea of starting a channel, and I did it. I was not consistent also initially on creating videos. I used to make and I used to stop and stuff. But past 1 year, I saw a lot of encouragement, motivation from you guys, and that made me feel that yes, this is the place where I can make a lot of difference in people's life and I can do a lot of things. And that's when I decided, okay, I would be pursuing Health Q channel as more seriously, and I would be taking this channel further ahead. So thank you so much for helping me on doing this. Now, and quick update. Yes, Health Q is going a little bit more bigger, in the sense. We are trying to create this as a platform for family. When it comes to family, we have you are there in your family, your husband is there, or your kid is there, your elder is there. So everybody is so connected to each other, and one person's health problem impact everyone. So we would be trying to touch all the pain points that you have related to your health problem through a video. So make sure to stay tuned with us and also share our channel with other people and let them also subscribe in, and please share your feedbacks also, what you would like to see more on our channel. More feedbacks you share, it is more helpful for us to reach out to more people, make difference in life of people, and help in some way where it's okay to make a small difference, but if we are able to give a small help in feeling better, in being able to feel better for someone, it's a major milestone for us. So please connect with us. Yes, we have some people joined in live. So there is Mr. Shailendra Morwani. नमस्ते. यस, आई नो बहुत लंबा टाइम हो गया उसके बाद मैं आई हूँ ऑनलाइन. बहुत सारी चीज़ें थी, पेशेंट्स ज़्यादा थे, बहुत कुछ चल रहा था, उसकी वजह से मैं नहीं आ पा रही थी. बट आई ट्राई माई बेस्ट टू कीप ये लाइव सेशंस ऑन एंड ऑफ. सो please, thank you so much for being patient with me. Mr. Asif Iqbal is there. Hello, namaste. Anita Jain is there. She's asking, thank you Anita for joining me on live session. So yeah, first we will do a Q&A session. So make sure if you have any questions related to your health problem, just keep on posting in the live tab on the comment bar. So if you have any question, you can just post there and I'll try to answer them. I remember somebody asked for spastic diplegia exercises. So I told that I'll be creating those videos and I'll be uploading. So I have made a content with some tips, because honestly, when it comes to spastic diplegia or any kind of exercise videos for a child with a special need, the exercise has to be very specific depending on the child's needs. Yes, Mr. Shailendra was there. You said right, yes, my kid has spastic diplegia with dystonic component. He's 7 years old. He has problem while walking because of pelvic bridge movement. What should we do? Exactly. So I still remember your question, and one small piece of video I've made. It's not a demonstration of exercise, but I've shown the principles that you should keep in mind while doing exercise. In terms of, in particular, Mr. Shailendra, can you tell me, would you like to listen this in Hindi or English? कौन सा medium मैं use करूँ so that you are comfortable with this? So अगर आप पोस्ट करते हो तो मैं हिंदी में भी बात करने में कंफर्टेबल हूँ. मैं हिंदी में भी आपको ये explanation दे पाऊंगी. Okay, so English, fine. Okay, Mr. Shailendra. So let me explain this in English. So spastic diplegia is a situation where the muscles the tone of the muscles, especially the lower limb muscle, is less, and that's why the pelvic tilt happens. If I'm not wrong, your kid is having posterior pelvic tilt, Mr. Shailendra. Am I right or wrong? If you can just tell me. If you can just type me and tell me that if your child is having problem of posterior pelvic tilt, right? I still remember that. Okay, so when see why I'm not making a particular exercise video for this. I was trying to make it up, but this might mislead some patients. That's the reason I'm not making a video. What I would suggest is you can focus on all the exercises that improves the anterior pelvic tilt, improve the anterior pelvic movement. Just a moment, sorry. Sorry. For example, pelvic bridging. Really sorry for this. For example, pelvic bridging. Make your child to lie down completely straight on the bed. Make the legs of your baby or your child should be bended, and then ask your child to lift up the pelvis. Okay, sorry. Really sorry for this. I am allergic a bit these days. It's sunny, so too much of dust is going on. That's why I'm sneezing a lot. Okay, yes. So pelvic bridging exercise is one thing that you should focus on. To pelvic bridging. Same way, keeping your one leg straight, the child's one leg straight and one leg bent like this, and then you make the child do the pelvic bridge this way. You are doing pelvic bridge exactly. Good, perfect. How many repetitions you do for pelvic bridging, sir? How many times your child does pelvic bridging movement? Okay, so ideally the pelvic bridging movement should be around 5 repetitions minimum. You can extend it up to 7. Maximum is 10 repetitions. Don't do more than that because the child. Okay, you are doing advanced pelvic bridging as well. Perfect. So then you should continue doing that. One thing is that. Second thing, you can focus more 5 times in a day. Okay. Okay, 5 times in a day, if it is doing, then it's a time that you should progress more towards, say, around 8 or 10 repetitions. I would not suggest more than 10 repetitions. Just do 8 repetition in one set. So, like that, you can do 5 sets. Now, it depends on you whether you want to make sure that the child does all the sets all together, like in the one go in the morning or else evening, or else you can divide the 5 sets in 3 bouts, like morning 2 sets, afternoon one, and evening one, right? So that is one exercise that you should focus on making your child do lunges is the movement where a child is standing straight, and then make your child to lift up one leg and put it forward and bend from both the knees. This is also a very helpful exercise in improving the trunk control, at the same time the alignment of the pelvis. So lunges is very important. Make sure you do lunge for both the legs. Don't focus only on one leg. Focus on lunges of both the legs. Third exercise that you should do is basically your squatting, sumo squats, basically, where you are ensuring that your child's foot is in external rotation and kept it little outwards, like the foot is like this, not this way. The child will tend to keep the foot this way, but his foot should be outside and the leg should be spread apart. Okay, and then you make your child do squatting movement, like standing up and sitting down. James, give me a moment, I'll come to your questions as well. So I'll just finish the exercise, what I would suggest for improving the posterior pelvic tilt. Second thing, what you can focus on, making your child do cat and camel exercises. If you Google this, you will very easily get what is cat and camel exercise and how it should be done. As in progression, you can ask your child to go into Superman pose, in which he is first in all four position or else quadruped position, and then raising one head straight up like this, and then one leg backwards also they have to raise it up. If you do that, that would be helpful and will be helpful in, yes, cat and camel exercise. You can Google, sir, you will get how to perform cat and camel exercise. It's very simple and easy exercises. you can make your child to do cat and camel exercise. It will be really helpful. Okay, and to for more advanced based exercise, you can also, yes, I have shown in some of the videos, but I would suggest there are many videos available on internet which explains the methodology or is the technique of doing a cat and camel exercise. Better you see it once and then you teach your child, or else ask your physiotherapist. He would be very easily able to teach cat and camel exercise. Now, once the child finishes cat and camel exercise, then he has to practice kneel sit to kneel stand movement. Okay, so kneeling down and then standing up, sitting down, standing up, sitting down. That is something that you should do. After kneel sit to kneel stand, then he has to practice from kneel sit, chronological process which needs to be customized. Every child is different, so I didn't want it that if I make this video and some poor kids who are not able to do this movement, their parents force them to do it and they'll end up in injuries. That's the reason I have not made this video. But for your child, definitely you can go ahead with that. And also make sure that your child is practicing more of physio ball activities. Physio ball activities in which we force on knee walking independent. Yes, knee walking is good, but make sure that this knee walking is with a proper support where his spine is staying erect. He is not going swaying backward. If he sways backward, then again the posterior pelvic tilt will increase. Here we have to improve the anterior pelvic tilt, or else we have to make sure that the child goes in anterior pelvic tilt. So a quick way or as easy way for force knee walking is giving him something in his hand, and then he can walk it. Yes, Swiss Paul Ishan is there online. He's a physiotherapist. I would like to introduce him to you guys. We are connected on via internet and share a lot of clinical knowledge. So what he's suggesting is also right. Swiss ball is helpful. Yes, keeping a Swiss ball in front of the child and then making the child to do kneel walking would be helpful. Or else if Swiss ball is getting little unstable for the child, then you can also give a walker, or else anything that is stable, a chair. Even a chair helps in that terms. And then pushing the chair, the child can do walking, kneel walking, right? So that is one thing. Even also, see, there will be this tendency that your child will go in the plantar flexion position, or else he would be trying to walk on the toes. Hence, it's very important whenever you make the walking exercises or whenever you make your child walk, he wears ankle foot orthosis. Ankle foot orthosis helps to keep the foot in a proper position. Proper position is something that is helpful. So I would suggest this exercise. I would not go much deeper into it. If you let me, if you don't mind, can you tell me you are in which city? If you can tell me, if I know someone whom I can suggest, I can tell you, you can go to that physiotherapist. But please make and customize exercise protocol for your child, and that only you follow. That is much better. Jodhpur. Okay. So I'll just try and connect if I get to know someone, some known physiotherapist who's good around in an area of. If yes, then it's good. Ensure that they are in a proper, well placed position. Like it is not something that is in Hyderabad. Okay, so fine, you can go to that, but make sure the local physiotherapist at least give once or twice a visit to that person, a physiotherapist, a good physiotherapist who can, you can say, customize the exercise. It's very important to decide, and progression also is very important. I can tell you one thing, three things you always keep in mind while exercising your child. One is, make sure start with mobility exercises. Mobility exercises, when you do for your kid, you have to ensure you move all the joints of the body. You don't have to move it. Ask your child to move it. So if it is related to leg, raising up the leg, raising down, moving the leg side to side, rotating the leg, bending the knee. So make your child to do this actively as much as possible. 10 repetition is fair enough. Once you have done that, start with stretching exercises. Stretch the tight muscles. Mostly the hamstring group of muscles are tight. The iliotibial band is tight. The calf muscles are tight. Regularly stretch these muscles and then slowly progress on the strengthening exercise. Incorporate play based activity also for your child, like kicking a ball, holding a ball on the leg. So if more of the play based activities involved, that would be much more helpful. So I hope this answers your question. So now I would move on and answer some of other questions that has been asked. So there's the next question is about James Remai, and she has asked, he has asked, mm, ma'am, hamstring is dynamic, but it is tight. Yes, so you have to regularly stretch the hamstring muscles. Otherwise, they will keep on going tight and tight. Okay, so you can also go for myofascial release or some sort of massage that is done in right way. Again, I would like to tell this very specifically. Massage should be happening in a right way. So, some kind of release and stretching has to be done on a regular basis so that the hamstring gets its extensibility as much as possible. Yeah, so James have asked, can you explain what is Bell's palsy? Okay, and which food is harmful for Bell's palsy and food that is good for Bell's palsy? James, I've made an entire video related to food for Bell's palsy. I would highly recommend you watch that video. It almost explains everything. When it comes to Bell's palsy, what is Bell's palsy? Bell's palsy is only diagnosed when there is a viral pathology involved in the facial nerve, the nerve that lies on inside your ear. When this nerve gets inflamed or gets swollen, that time there is a compression that comes on that nerve, which leads to the symptoms of paralysis of the face. Mostly Bell's palsy gets absolutely normal or cured within 3 months. But sometimes, unfortunately, people tend to develop some secondary complications like synkinesis, or sometimes some people develop recurrent Bell's palsy due to poor immunity level, due to recurrent ear infections, due to incomplete resolving of ear infection. At that time, Bell's palsy can recur, or else could also lead to partial recovery from Bell's palsy. So that's what is all about Bell's palsy. Okay, so I hope this answers your question. When it comes to food, you food is almost the same. You don't have to cut on anything, especially. But the food that contains arginine, like walnuts, is something that you should avoid, and avoid food that is oily or is it's fried, because it's more of inflammatory. So that also reduces the level or its impact of your recovery that is possible. Right, so that is something that you should avoid, James. So I think that answers your question. I'll take the next question, and that's from Priya. Hi, Priya. I am a Bell's palsy patient, and I am near to third month. I can now smile, but my eye and eyebrows are still not normal. Only slight movement is there. Please suggest. Priya, then what I would suggest is I would highly recommend, since 3 months are done, you can focus on the exercises that's more towards your eye and eyebrows. Give some assistance if you are not able to move. For example, if this movement is difficult for you from this side, then what you need to do, just press it or stop this movement here and then raise your eyebrow here. So this will help in doing or else initiating the movement. You can slowly also involve your voluntary movement here while doing this. That would be helpful. Similarly, you can do the movement from here, same way, closing the eyes. So here I'm resisting it, here I'm assisting the closure. So that's how simple. You have to be very patient with your recovery. Sometimes it takes time, but just focus that you do not develop synkinesis, which is a secondary complication of paralysis. This should not happen, because if this happens, it's very difficult to manage. It takes more time. It's not that it doesn't recover at all, it just takes more time. So I hope this answers your question. Um, Priya, you are also asking, should I visit a neurologist or ENT now? I'm doing exercises and also applying warm clothes. It's better to visit a neurologist since your 3 months are done. If you want to continue some of the medications, it you will get to know. We, as in physiotherapists, do not prescribe medicines for Bell's palsy. So for that, you anyways have to go. So it's good to go, but exercise is something that you have to continue doing, Priya. That will in long run help you. Right. So Mr. Shailendra says, thank you very much. Thank you, Mr. Shailendra. I hope this answers your question, James. Thank you again. So I think I was able to answer most of the questions. Just let me go through any other question if I have left. Okay. Fine. So now comes the giveaway time. So the good news is we ran this giveaway, and in that giveaway, we got 11 participants, and we have 11 gifts to give you guys, right? So almost everybody who participated, following all the proper rules that were mentioned, is in and will receive some sort of gift. Now comes the announcement of the giveaway. So there were 10 ice packs, and there was one 500 worth Amazon gift voucher. So since there were 11 entries, so everybody is getting something. So here I have this bowl of chits of the people who participated. What I'm going to do is I will pick one, and the person whose name comes in would be the winner for the Amazon gift voucher, and rest would be the winner for the ice pack, would be eligible to claim for the ice pack. I'll also show you the ice pack what we are giving away. This is that ice pack. It's from Ultra Care Pro. It's very simple to use. I will show you mine. It's not in that great condition, but this is something that I'm using past 3 years now, right? And you can see how much I've used. Like it has gone, but it's really effective and it's very good. So this is the same ice pack which you would be getting. All you need to do is just open this lock here and here. You have to fill some water, mix it, shake it well so that the ingredients gets mixed well, and seal it again and keep it in the freezer, and your ice pack is ready. You can use it anytime when you need. So yeah, that's it. Okay, so we have one more question. I'll just, before announcing, take that question. That's from Mr. Raj. मेरी बेल्स palsy बहुत स्लो रिकवरी हो रही है, मेडिसिन भी चालू है और फिजियोथेरेपी भी. सर थोड़ा सा आप पेशेंस रखिए, आप एक्सरसाइज को कंटिन्यू कीजिए. कई बार टाइम लगता है, लेकिन धीरे धीरे चीजें रिकवर हो जाती है. एक्सरसाइज कर बिल्कुल भी मत छोड़िएगा. ये सबसे इम्पोर्टेंट मैसेज मैं यहाँ पे आपको देना चाहूंगी. Okay, guys, so coming to the giveaway. So, who's going to be the winner? Okay. Fine. So, I have picked the name, and the winner for the ice pack is Mr. Pranav Saxena. Okay, so I hope, no, I don't think so. Mr. Pranav Saxena is right now watching this, but he is the winner for the Amazon gift voucher. That's worth rupees 500, and all the people who have participated will get an ice pack. So, in order to claim this giveaway, all you need to do is send me an email or else a direct message telling that claiming I would like to claim my ice pack, and you would be receiving, you have to send your contact details where we can mail you your ice pack. So we would be sending that. And even for Mr. Pranav Saxena, for this also you have to send me a DM or else an email. My email ID is mentioned in all the descriptions of my video, and you have to just claim your giveaway. Yeah, so that was it. Thank you so much for participating in this giveaway and supporting me. Please keep on supporting me the same way as you have always supported. Uh, Again, I would like to tell you there's lots and lots of content, information, health motivation stuff coming up in this channel. So please stay tuned with me. There will be a lot of other people coming on board as well. And we would try to make your life more healthier, more better. So, on that note, let me end this video here. Bye bye.